An asthma attack, also called an acute asthma episode, a flare-up, or exacerbation, is a sudden increase in the symptoms of asthma, including rapid, shallow, and difficult breathing, feeling that you cannot take a deep breath, or chest tightness. Also comes with cough and excess mucus production. Children experiencing chest tightness may complain of a stomach ache because they're not sure how else to describe it. Whistling noises when breathing, is known as wheezing, is also a common symptom of asthma. The symptoms can be mild, moderate, or severe, depending on how much the airflow into your lungs is reduced. Attacks can be brief, lasting about an hour, or they may last for days. They may be similar to hay fever and occur seasonally, or they can occur during any time of day or night. Asthma symptoms may develop suddenly, or they may develop after hours of being exposed to a trigger, such as tobacco smoke, animal dander, pollen, or workplace hazards. In some cases, as with your job, symptoms may develop 4 to 12 hours after your exposure to your trigger, which is something that irritates your lungs and brings on these asthma symptoms. Inflammation leads to an overreaction of the breathing tubes and triggers a tightness of the smooth muscles in your bronchioles, which feed air into each lung. Now, when these airways become constricted, they can't hold as much air. But the other element of asthma, the excess mucus production, also blocks and closes up these tubes further and makes you feel like you need to cough and remove the mucus. The mucus glands are very active in most people with asthma, and that's a big element of the disease. Although the attacks can be serious, they can usually be treated at home with home medications and what we call inhalers and a home nebulizer, which breaks up medication into tiny particles so you can mist it and breathe it into your lungs for treatment. Now, you should talk to your doctor about your asthma and find out what your asthma action plan should be. This should include a written plan that tells you what medication to use based on the severity of the attack, when you should seek a health professional or emergency treatment. You and your health professional create this action plan together for you or your child. Children in schools will be required to have an asthma action plan on file with the school. As long as the medications that they need are available, children can treat their asthma attacks effectively at school. So, talk to your doctor. The best strategy for avoiding and treating asthma attacks will be using your regular medications to keep inflammation down. The best action plan will be a combination of factors that work to keep the inflammation down, to reduce your sensitivity to allergic triggers like hay fever, things like that. Medications that reduce the production of mucus, as well as medications that can dilate those breathing tubes called bronchioles and allow more space for the air exchange in and out of your lungs. And those breathing medications come in the form of an emergency inhaler, a quick puffer, some people call it, that you can use immediately, and the nebulized medication that you need a small electric machine to deliver the medication in a mist that you or your child can breathe in. So talk to your doctor about your asthma. Asthma can be a life-threatening condition, but with good management, you can treat the symptoms early and prevent any major illnesses most of the time. Be prepared, be knowledgeable, and be informed. Asthma is something you can live with.